There will be times when something will happen and you think to yourself like, wow, this patient may sue me or could sue me, or I could see that happening. And if you have a good relationship, or you can create that relationship, even in when things are negative, that will probably save you 9 times out of 10 from, litigation. So, for example, like I've had that happen several times, and what's funny is the patients that you have in certain patients, if you have complications, if you are all of those things, or if you are, affable and responsive and proactive and have a good attitude and all of those things, sometimes you build the best relationships with those patients and you laugh about it later with them. So that's kind of a phenomenon I've noticed, that those patients where we've had a failure or a infection or something unforeseen, a complication, most of the time they stick it through with you because they trust you. There's some confidence there and they like you and they think you know what you're doing and they have confidence in you. Then most of the time those turn out to be like actually some relationships, not maybe long term, but just like you laugh with these people and you've seen them through something. You know what I'm saying? And so
Yeah.
I've seen that time and time again. And then the other thing is, just if something happens, definitely something negative, a bad outcome, definitely apologize to patients. But you don't necessarily that doesn't necessarily mean you did something wrong. For example, when I'll say something like, "I'm sorry this has happened," or "I'm sorry this is happening, and I'm
Yeah.
going to help you through, and I'm going to help you as much as I can in any way that I can help you." And most people are pretty reasonable with that.